Every year, once the state MD entrance is over, we all enter into a state of happiness and also sadness equally, and we will be out of the post-traumatic stress disorder of the failure in the last entrance exam with the onset and blooming of the notification of AIIMS and PGI. I am very happy to see also a lot of you who attended our mock test series last time. Every AIIMS May is a call to see you all once more, so that we are in the beginning of the harvest for the next year, and then once more the November AIIMS and PGI and All India and the state entrance. Within no time October will come and November will be once more the era of notifications will begin. So with that preamble, let me start the historical review of AIIMS May 2015. At the onset, let me thank all the students who recalled the questions and have sent it on the WhatsApp. Rutika, Sridhar, Swati, Rupam, Anusha, Archana, Saroja, everybody who are attending online, most welcome. Can the online students can punch whether the voice is loud and clear? Can you slightly give me voice? What is the analysis of AIIMS May 2015? Any MD entrance in India that you go, what is the rule of 130, 50, 20? Do you know what is that rule? 130 questions out of 200 questions are most predictable questions. Anybody who prepared for entrance exam will be able to answer 130 questions confidently. 50 questions are situational intelligence. Nobody will be able to predict. No entrance exam coaching can be able to tell you. There and then you need to use the brain and answer. 20 questions Allah Miya ke haath mein hota hai, which you cannot answer. Out of these 20 questions, 7 are numericals in this AIIMS exam. 13 questions are completely idiotic questions. You don't need a brain to be carried. Only your astrology, Shukra Dasha, Shani Dasha must come with you to help you. I'll discuss these questions at last. First, let us discuss this 130 questions which are most predictable questions, and they have come from 700 high-yield topic lists which has been given to all of you long ago before going for exam. So let us make the great beginning. Now doctor, independent assortment of the chromosomes occurs at which level of spermatogenesis? Once assortment occurs, a diploid cell become haploid. So if you look at the evolution of spermatogenesis, you have a primary spermatocyte, it is diploid, it becomes secondary spermatocyte which is haploid, which ultimately converts into spermatids. We have discussed this question many times in our mock tests on every Sunday. So that is the reason. What is your answer, doctor? When primary spermatocyte becomes secondary spermatocyte, that is the point where the independent assortment of the chromosome and conversion from diploid into haploid will occur, is what need to be remembered. Then the next important question is, which cranial nerves have got general visceral afferents? If you look at the anatomy high-yield topic list, we have given you 60 topics which you need to revise before you go for any entrance exam. Top 7th or 8th topic is cranial nerves. Every entrance you go, definitely one question will come on cranial nerves. So doctor, glossopharyngeal vagus, they have general visceral afferent. If you take glossopharyngeal, it is bringing the taste, right? And the vagus also is involved in bringing the afferents from the viscera, from the internal viscera. Oculomotor, 7th cranial nerve, 9th and 10th, they all basically carry general visceral efferent, which is motor. For example, you take the third nerve. Ultimately, third nerve will be carrying the sphincter pupillae contracting fibers through oculomotor nerve. Then similarly, 7th supplies secretomotor fibers. 9th and 10th are also involved in carrying the secretomotor fibers. So these all come under general visceral efferent. Similarly, you have general somatic efferent, special afferent and brachial efferent. This list ceremoniously you need to remember. Once more, PGI will be conducted next Sunday. You will have one question on cranial nerve. You can't escape it. Okay, doctor? So I leave the literature for you about general somatic afferent and efferents. This question is ditto what was asked in November 2013. We have all the previous AIIMS paper discussions available on our YouTube channel, youtube.com/onlinembbs, and also we have a free study content available online called anatomy2medicine.com and newsformedico.com. We will publish this question paper explanations also there. So doctor, mesorectal fascia contains superior rectal vein, it contains pararectal nodes, and it also contains inferior mesenteric plexus, is what you have to basically remember. Now what is a CART test? Recent NIMSET, some of you might have written. We have discussed last week only the NIMSET 2015 question paper. There was a question about the Froment sign in that paper. What is the rule of any entrance exam whenever you go? Radial nerve, medial nerve, ulnar nerve, musculocutaneous nerve, one nerve in the brachial plexus. इसके बिना अगर क्वेश्चन पेपर है तो मुझे दिखाओ. Definitely it will be there. So when you go for AIIMS entrance or any DAM entrance, you should not say paper is tough. How can any paper will be tough? It cannot be. 130 out of 200 will be predictable. अगर आप पढ़े तो आंसर जरूर करना ही पड़ेगा. 20 is not in your hand, but out of 20 आपके लक फैक्टर की वजह से 10 मार्क आ जाएगा. 130 plus 10 140 आ गया. Remaining 50 situational common sense. आप हाउसमैनशिप करते वक्त there was lot of observation of romantic heart disease or rheumatic heart disease. What did you do in your housemanship will be a deciding factor. If you have done good housemanship, common sense automatically will be there. For example, there was a question, screening is not useful in which carcinoma, was a question in AIIMS. वो कुछ prepare होके answer करने वाला question है क्या? Options were breast cancer, colon cancer, prostate cancer and testicular cancer. Have you gone to population to every house and started checking the testes of all the people screening for testicular carcinoma any time in your housemanship? You have not done. But you have done rectal examination. You have done colonoscopic screening. You have done breast screening. So that is the reason, common sense wala question. So, what is the answer, doctor, for CART test? We have two kinds of interossei. Palmar interossei and are adductors of the fingers. Dorsal interossei are the abductors of fingers. Pad and dab. So CART test is the one which basically will be testing palmar interossei, is what you need to remember. There were in fact two questions in the last NIMSET on the same ulnar nerve. What is meant by ulnar paradox? Generally, whenever there is any injury to the ulnar nerve at wrist versus elbow, higher the level we expect a greater deformity. But there will be lesser deformity whenever there is a injury at elbow and more deformity and more clawing whenever injury is at the level of the wrist, which is called ulnar paradox, is what you need to remember. What is the active metabolic layer of the bone? Basically bone के अंदर क्या होता है डॉक्टर? एक outer cortical bone होता और अंदर वाला cancellous bone होता. Cortical bone is separated by one periosteum on the outside and one endosteum on the inside. Endosteum separates the cortical and cancellous bone. Your Haversian system, Haversian canals, osteoblasts, वो सब कहां होता है? कैंसलस में नहीं होता, कॉर्टिकल में होता है. इसलिए कॉर्टिकल बोन इज कॉल्ड द मेटाबॉलिकली एक्टिव कंपोनेंट ऑफ द बोन इज व्हाट यू नीड टू अंडरस्टैंड. नाउ डॉक्टर, व्हाट आर द मेसोनेफ्रिक डेरिवेटिव्स is the question. When you took the exam, if you are surprised to see this question, means you are too late for this exam and too early for the next exam. एक न्यूरल क्रस्ट डेरिवेटिव्स होना ही पड़ेगा, एक मेसोनेफ्रिक डक्ट्स डेरिवेटिव्स होना ही पड़ेगा. Let me tell you, doctor, in a very simple terms for you. Basically when you go for entrance exam, पूरा 19 subjects मिला के you have got 1100 high yield topics. I hope if you have not collected the high yield topic list, please collect it, the printout of the high yield topic list. उसमें 700 topics are most high yielding. They are arranged in the descending order of the priority for you. Each topic के ऊपर you need to know 20 points. Hypertrophic obstructive cardiomyopathy है, for example. You must know that it is autosomal dominant, it leads to sudden cardiac death. If you use nitrates, there is a worsening of HOCM, etc. 20 points. That means 700 into 20 means कितना हो गया? 14,000 points. If you know you are a topper in any damn entrance in this country, doctor, let me tell you. Out of this 14,000, you have 3,000 points which are stupid numericals. Eustache chain tube का length कितना होता है? नहीं तो अगर आप एक्सरे को एक्सपोज हुआ तो रेडिएशन डोसेज कितना होता है? रैपिड सैंड फिल्टर में सैंड पार्टिकल का साइज कितना होता है? सेप्टिक लैट्रिन का डेप्थ कितना होता है? Stupid things, nothing to do with when you become an interventional cardiologist or a neurologist. They have no relevance. But you have to read. So 3,000 facts रहता पूरा 19 subjects मिला के. Then there are 3,000. These are numerical facts. These are the absolute facts. Absolute facts means left gastric artery is the one which undergoes bleeding if there is a malarious tear. Or otic ganglion is important for parotid gland. They are facts, not numerical, but non-numerical, but facts. Unfortunate facts which you need to remember. Then remaining 8,000 are the logically reasoned out issues. For example, why will you give thiazides which are diuretics, though diabetes insipidus is a diuretic state? It has got a logic for it. Why do you give thiazides in renal tubular acidosis of distal variety but not in proximal variety? There is a reason for that. Why there is a nephrocalcinosis only in distal type of renal tubular acidosis but not proximal RT? There is a logic behind it. Such logical things are around 8,000. ये 3,000 non-numerical facts जो है ना, इसमें आता है list. List का मतलब what are P450 inducers, what are P450 inhibitors, what are mesonephric derivatives, what are neural crest derivatives. ये पूरा ब्ला ब्ला आपके पॉकेट में रख के लिस्ट जाना है. अगर एंट्रेंस को जाने के बाद आप लिस्ट को देख के ताज्जुब हो गए तो यू आर नॉट रेडी फॉर दिस एग्जाम. ओके डॉक्टर, सो दिस इज वन सच स्टूपिड लिस्ट. नो नीड ऑफ एनी इंटेलिजेंस टू बिकम ए टॉपर. So what are the derivatives? Gardner's seat is an easy way to remember. Gardner's duct, seminal vesicles, epididymis, ejaculatory duct and ductus deferens. Not the glomerulus is not a mesonephric derivative, is what you have to ultimately remember. Which type of collagen is in basement membrane? From times immemorial, this is a favorite question. There will be totally 8 varieties of collagen. कॉर्निया में क्या होता, टेंडन में क्या होता, बेसमेंट मेम्ब्रेन में क्या होता है, एवरीथिंग यू मस्ट नो. इट कम्स अंडर दिस अनफॉर्चुनेट लिस्ट, नॉन न्यूमेरिकल factual list which you have to remember. Type 4 type of a basement membrane is what need to be remembered. What is the nerve which is beneath the facial colliculus? So कितने क्वेश्चंस आ गए cranial nerves के ऊपर अभी? 2 questions. So important is cranial nerves. So doctor, it is abducens. Typically, whenever the facial nerve is exiting, the facial nerve root is coming out. What are all the cranial nerves which are there in the pons, doctor? 5th, 6th, 7th. Midbrain, 3rd, 4th. 8th, 9th, 10th, everything else is in the medulla, is what you need to remember. So, whenever facial nerve is coming out, it will take a circumlocutus route around the abducens nerve. The nucleus in the pons cut section is what you need to remember. What are the attachments of lesser tubercle and greater tubercle? Once more, no need of intelligence. 3000 वाला लिस्ट में होना है. लेसर सियाटिक नॉच के अंदर से क्या चलेगा, ग्रेटर सियाटिक नॉच के अंदर क्या चलेगा. Greater tubercle, what attaches? Lesser tubercle, what attaches? You must be 100% sure. Infraspinatus, teres minor, supraspinatus, they all attach to the greater tubercle. Subscapularis and teres major, and they are the ones which basically attaches to the lesser tubercle, is what you have to basically remember. Now doctor, which is not a branch of external carotid artery. Does internal carotid artery give any branches in the neck? No. But what are all the external carotid artery branches? कौन सा वाला क्वेश्चन है ये? लिस्ट वाला क्वेश्चन. अगर आपके पॉकेट में लिस्ट नहीं रहे तो you are not prepared at all. So that is the reason while preparing for MD entrance exam, don't say I am preparing for knowledge. Knowledge 10 times अगर आप obstructed labor के बारे में बात करें पढ़े तो, if your own wife has got obstructed labor, can you pull the fetus out? No, doctor. So that is the reason practice only brings knowledge. All the knowledge of reading is only for passing exams. So be very sure, make your preparation concise. Don't go into information explosion. Winning entrance do not require more than 300 hours of preparation. You are preparing more than 300 hours means you are wasting the youthful joy of 23, 24, 25 years. The peak time where your testosterone, estrogen are really functional. So don't waste it. And within 4 to 5 months, if you spend 5-6 hours a day also, you should be in the top 100. Instead, if you become panicky, if you go into myths like knowledge is important, you see how simple are the questions. If you have the list in your pocket, what to read, what limited to read, you will definitely achieve. Okay. So, doctor, Sister Lily's powdered face often attracts silly medicos. I think all of you are quite attracted a lot of times. So, superficial temporal artery, lingual artery, posterior auricular artery, facial artery, occipital artery, ascending pharyngeal, superior thyroid, not inferior thyroid, maxillary artery, they are all the branches of the external carotid. Tips में रख के आप जाना पड़ेगा. Then doctor, which is secreted by beta cells of pancreas. ये तो 8th class biology वाला question है, right? So 130 out of 130 you have to get without any shivering and shaking. Remaining 50, be relaxed. You use your brain at that time. You don't need preparation. That 130 come from 700 topics, bus. So doctor, beta cells secrete insulin and amylin, alpha cells secrete glucagon, delta secrete somatostatin, gamma cells secrete pancreatic polypeptide is what you have to basically remember. Now doctor, what is the factor required for stabilizing fibrin thread? How many of you have taken AIIMS? Actually AIIMS made 2015 out of you, anybody? Was it the same question, or which factor helped platelet to adhere to the endothelium was the question? Huh? Both are there? Array. Coagulation cascade. In physiology, coagulation cascade is 8th or 9th most high yielding topic which you have to prepare. Okay doctor? And one more thing, anticoagulants, antiplatelets in pharmacology, even that is a very high yielding topic. So that is the reason you can't escape at least one, sometimes two questions like this on the basic hemostatic mechanisms. So doctor, fatafat bolo, what do you call extrinsic pathway basically? What is the whole purpose of our coagulation cascade? PT को T बनाना, प्रोथ्रोम्बिन को थ्रोम्बिन बनाने की कोशिश में PT को क्या बोलते हैं? फैक्टर 2 बोलते हैं. फैक्टर 2 को एक्टिव फैक्टर 2 बनाने के लिए दो चीज का जरूरत पड़ता है, फैक्टर 5 एंड फैक्टर 10. एंड फॉर्मेशन ऑफ एक्टिव फैक्टर 5 एंड 10 के लिए दो रास्ते होते हैं, एक इंट्रिंसिक पाथवे और एक एक्सट्रिंसिक होता है. एक्सट्रिंसिक में खाली एक फैक्टर होता है, वो फैक्टर 7, एंड एवरीथिंग एल्स 8, 9, 10 and everything else comes under intrinsic pathway. Intrinsic is tested by APTT. Extrinsic is tested by PT. And both of them get affected whenever 2, 5, 10. Any of these are affected, both of them are affected. Then where will factor 13 will come into picture? ये पूरा क्लॉट बनने के बाद क्लॉट को स्टेबलाइजेशन के लिए क्या चाहिए डॉक्टर? फैक्टर 13. दैट इज द रीजन अगर फैक्टर 13 की कमी हो गया, व्हाट हैपेंस टू द पेशेंट? पेशेंट विल टिपिकली स्टार्ट ब्लीडिंग क्लिनिकली, बट हाउ विल बी हिज पीटी एंड एपीटीटी? पीटी एंड एपीटीटी आर नॉट अफेक्टेड, क्योंकि ये पूरा क्लॉट बनने के बाद फैक्टर 13's रोल इज देयर. If factor 13 is deficient, it has no place in APTT pathway or PT pathway or in common pathway. So factor 13 deficiency हो गया तो bleeding diathesis will be there, but the PT APTT will be normal. Factor 7 कमी हो गया तो PT is prolonged and 2, 5, 10 will cause PT APTT together prolonged, and everything 8, 9 everything will cause APTT prolonged. This is the story which you have to be 100% sure about, doctor. Okay, now we have the factor 13, which is very, very important for the stabilization of the clot. Then the other fact is von Willebrand factor is required for platelets to adhere to the vascular endothelium is another fact. So Bernard-Solier syndrome, von Willebrand disease, and Glanzmann's thrombocythemia, where is dystocytin factor assay abnormal and normal, all those bleeding diathesis you have to be 100% sure, doctor. Now, which beta receptor induces lipolysis? Whenever you start preparation, first thing to read is autonomic physiology. फिर भी थोड़ा वक्त मिले तो ऑटोनॉमिक फार्माकोलॉजी. If you are not good in physiology, pharmacology of autonomic nervous system, what are beta blockers, alpha blockers, alpha agonists, alpha 1A, etc., etc., entire preparation will be very shaky. Okay, doc? So, beta 3 is the fat cells is what you need to, lipolysis is induced by it. Similarly, one more function of beta 3 receptor क्या होता है? Thermogenesis in skeletal muscle is the second important function of the beta 3 receptors is what I want to underscore to all of you. Now comes our favorite topic. Any entrance you go without a question on lipoproteins होता क्या? Paper नहीं होगा. In fact, not one question, 2 questions on lipoproteins are there. Hyperlipoproteinemia and lipoproteins. Without that, there is no paper. Okay. So, doctor, patient has got tendon xanthomas. The blood is having milky appearance. Then which lipoprotein is basically increased? Basically, milky appearance means chylomicrons. Chylomicrons carry cholesterol or triglyceride? Triglyceride. VLDL carries cholesterol or triglyceride predominantly? Triglyceride. LDL carries predominantly cholesterol. So accordingly you have mixed hyperlipidemias and isolated hypercholesterolemias and isolated hypertriglyceridemias. How will be a diabetic patient's typical lipid profile will be, doctor? Normal cholesterol with high triglyceride levels is what you basically have in a diabetic profile. Basically, why hyperlipidemia comes in diabetes is a very important biochemical explanation you must be ready with, because that is one of the favorite questions of the examiner. Why diabetic patients have got hyperlipidemia, what is insulin sensitive, lipoprotein, lipase, everything you must be sure. This is called lipemia retinalis. Nowadays we are all having image based questions, right? So severe hypertriglyceridemia with lipemia retinalis, with a creamy white appearance of the retinal vessels, they are all the features of the type 1 hyperlipoproteinemia, which is autosomal recessive, and it is also called hyperchylomicronemia is what you have to basically remember. Then there is elevated LDL. I am not sure whether normal level of LDL receptor was given or triglycerides was given. Anybody can recall? LDL receptors was given. Okay. What is the type of hyperlipidemia? Basically it is, whenever LDL is severely elevated, doctor, there is only one type of hyperlipidemia that comes. It is called type 2 hyperlipidemia. Only cholesterol is significantly elevated. Isme once more you have a 2A variety and 2B variety. I leave the literature for you, but I was not sure exactly what the examiner wanted in this hyperlipidemia question. So, but if it is correctly reconstructed, probably we can get the correct answer. Why there is a lactic acidosis if there is a thymine deficiency is a very, very important question. Thymine is important for pyruvate dehydrogenase as a coenzyme. Pyruvate dehydrogenase converts pyruvate into acetyl-CoA. If pyruvate cannot become acetyl-CoA, what will it become? It will convert into lactic acid. Hence, there is a development of lactic acid whenever there is a thymine deficiency. What are the 2 classical scenarios of thymine deficiency in clinical practice? One is those who are alcoholics, who are only given glucose to correct their hypoglycemia without giving thymine. Second is those who are on total parenteral nutrition for a long period of time. One of the complications is thymine deficiency is what you need to basically remember. This is the beautiful question I am waiting since long time. देखो डॉक्टर, प्यूरीन pyrimidine मेटाबॉलिज्म और यूरिया साइकिल, ये दोनों में डेफिनेटली एवरी एंट्रेंस आप गए तो एक क्वेश्चन डेफिनेटली आता है बायोकेमिस्ट्री में. If you don't read and go, you are missing, you are mercilessly losing one point, one question. Okay, so high blood ammonia, urea cycle disorder, and there is an accumulation of glutamine. Which one it is? Very simple. If you look at the urea cycle, you have got a lot of list of enzymes. What is the first step in I think the urea cycle image is not there. Okay. What is the first step in the urea cycle? The first two steps occur in the mitochondria, then it will occur in cytosol. In the first step of urea cycle, ornithine transcarbamylase is the enzyme, which is the one which will capture the amino group given by the glutamate and make the amino group enter into the urea cycle. That is the first step. Suppose if this OTC is abnormal, ornithine transcarbamylase is abnormal, deficient in the people, क्या हो जाता? Glutamine cannot deliver its ammonia into urea cycle. And glutamine कहाँ से pick up कर रहे? दूसरे amino acids से pick up कर रहे. All amino acids, when they want to give their ammonia for detoxification, they need to donate it to glutamine. Glutamine picks it up and brings and makes it enter into urea cycle. And for the entry, who is the first gatekeeper? Ornithine transcarbamylase. So any deficiency of this will automatically lead to hyperammonemia and accumulation of all the amino acids like alanine, glutamine, etc., which they thought they will give their ammonia into urea cycle. They get accumulated. If any other enzyme of the urea cycle is abnormal, below the level of the OTC, you will only find hyperammonemia and one of the intermediate abnormal, but not glutamine or alanine accumulating. So that is the whole idea behind urea cycle abnormalities. Then one more important rule. Which enzyme deficiency typically which enzyme deficiency will not lead to the development of hyperammonemia in the urea cycle? Urea cycle means lot of enzymes are there. The starting point is what? Ammonia enters into urea cycle. End product is what? Formation of urea. Is the enzyme towards the urea, if it is abnormal, will you have hyperammonemia? Or the enzyme which is in the beginning part of the urea cycle, if it is abnormal, you will get hyperammonemia? Beginning. Arginase is the enzyme which comes towards the end. That's the reason अगर arginase की deficiency है तो hyperammonemia नहीं होगा urea cycle में. That is one of the favorite questions of the examiner. अगर ornithine transcarbamylase, which is the first enzyme, where it is picking up ammonia, if it is deficient, you will have hyperammonemia along with the rise of the glutamine. That is what you need to remember. So, all UCAs, urea cycle enzyme deficiencies, you have to UCDs. After going home, you need to revise, doctor. Once more, you will come for PGI discussion, no? Without a question on urea cycle and purine pyrimidine metabolism, there will be no paper. So that is the reason, don't go into a expectation of इतना पढ़ना है, उतना पढ़ना है. उतना पढ़ने के लिए कुछ भी नहीं है. Let me tell you. खाली 700 टॉपिक्स पढ़ने का है. हर एक टॉपिक के अंदर 20 पॉइंट्स होता है, वेरी की पॉइंट्स. उसमें से बत्ती मारने वाला पॉइंट्स होता है. ऑल इज नॉट ग्रीन व्हाट यू आर लुकिंग. देयर इज आल्सो सम liquefactive necrosing process in the brain to remember, reproduce, recall, etc. and mixi process is there. तो इसलिए ज्यादा मिक्सी के अंदर डाले तो मिक्सी खराब हो जाएगा. तो इसलिए मिक्सी में थोड़ा डालो, अच्छा निकलेगा और अच्छे अच्छे इडली बनेगा. तो दैट इज व्हाट इज वेरी इंपॉर्टेंट. सो डोंट ओवरबर्डन योर ब्रेन. डू यू थिंक if you prepared for 700 topics thoroughly, these 130 questions, are they not achievable? Easily achievable. Remaining 70 को गोली मारो, एंट्रेंस में देख लेंगे. मगर इसमें अगर कुछ गड़बड़ हो गया, धोनी इज डकआउट, इन सेमीफाइनल हो जाता. अगर इसमें गड़बड़ हो गया, इट इज लाइक यू आर एक्सपेक्टिंग अ लॉट अबाउट धावन, that he will play like this, sixers मारेगा, इस तरह मारेगा, उस तरह मारेगा, कुछ भी नहीं मारा, फर्स्ट 10 और 12 हो गया, नेक्स्ट एक सिक्सर मारा, किसी ने कैच पकड़ा और शिखर धवन इज आउट। वैसे हो जाएगा अगर ये 130 क्वेश्चंस में अगर कुछ गड़बड़ हो गए तो। सो दैट इज द रीजन 700 टॉपिक्स 130 क्वेश्चंस, smoothly you must answer 130 out of 130, no compromise if you want to be in the top 100 ranks. Now doctor,